Hi, this is Tracy from Hypsidon's Equestrian. Thanks for joining me for this week's video where I have a look again at our senior horses, and this one in the series I'm going to be talking about horses' teeth and dentition issues. Please, before you start, don't forget, if you're enjoying these videos, subscribe to my channel and click on that like button. It really does give me a lot of support with the algorithms on YouTube. Decades ago, senior horse dental care wasn't as important as it is now because the horses didn't tend to outlive their teeth. With advancements in care, we are seeing horses living longer, and it becomes more and more important that we proactively care for our senior horses' teeth, as it really can cause them quite some problems. We obviously aim to ensure that our senior horses have the highest quality of life that they possibly can. And to do this, I think we need to be much more proactive in their dental care. So equine teeth are called Hypsidon, and this means that there's a lot of tooth under the jawline. If you're not sure what that means or you want some more information, I have got a video on horses' teeth, and there will be a link up here for you to click on that and have a look. But essentially what happens is the horse's teeth are long in the jaw and continually grow down, and that growth should be equal to the wear and tear from the horse's chewing. The part of the tooth that is underneath the gum and jawline is actually called a crown, and obviously as the horses are living longer, teeth are wearing, and there can often be simply no crown or no tooth left. The other problem that our oldies can have is changes of shape to the jaw and also the angle of the teeth, which promotes the wear to not be even or symmetrical. It's actually estimated that about 88% of horses over 20 have dental issues. So that's why it's so very important that we get on top of these. One of the biggest signs of teeth problems is a drop in weight despite feeding, the horse looking like it's having trouble eating, or quitting, which is where a horse grabs a mouthful of food and it just simply falls out of their mouth. These are very obvious signs that your horse may need some dental care, but please don't rely on these alone, as there are many other things that can happen that don't have such overt signs. So it's very important that the older horses get dental care, preferably twice yearly, so that somebody can have a good look in their mouth and check there's really nothing untoward going on. So what are some of the common problems that older horses have with their teeth? One of the first one is, like I mentioned earlier, losing teeth. Now, as a horse chews, they chew sideways and also circular. If they lose one tooth, then the opposing tooth can actually get caught and locked in the jaw in that section during the motion, which means that their chewing motion isn't correct. This results in the jaw joint, or the temporomandibular joint, TMJ, becoming sore and painful, and the jaw getting quite locked up. As this jaw gets locked into a particular type of motion and this joint gets sorer or even more worn in certain areas, this of course is simply going to affect the horse's eating even more. So it's very much a snowball effect. Of course, a tooth infection is also a possibility, especially with loose teeth, some pockets in and around the teeth, or when the teeth are lost, there's always the possibility for an infection or even a fractured tooth that does cause the horse a lot of pain. The risk of infection is actually elevated in our senior horses that have also been diagnosed with Cushing's. Now, if you're not sure what Cushing's is, have a look at the video I've just done about senior horses and their risk of Cushing's disease. But one of the symptoms of Cushing's disease is that their immune system is lower. So with missing teeth or pockets, etc. in the mouth, these horses can be at much higher risk of getting infections. Another problem is a wave mouth or wave teeth. Now, many horses have this, and when it's mild, it doesn't normally cause them too many problems. But as a severe wave mouth, which means that there are tall and short teeth in the same row of cheek teeth, can really, again, inhibit the horse's ability to chew their food properly. Sharp points and hooks, and again, all horses are a little bit prone to this, but as horses get older, they don't chew the right way, their teeth change shape and angle. Quite often, our senior horses get very tall, sharp points and hooks at either the front or the back of the cheek teeth. This is actually quite painful for the horse and can cause abscesses in the cheek and all sorts. Certainly does inhibit their eating once again, but easily solved by dental visits and filing these points down. Often our seniors can also have problems getting food trapped in between their teeth or in the pockets at the bottom of their teeth. This, of course, can cause the tooth to become infected, a little bit more loose, and once again, affect their ability to eat properly. And although most of their chewing gets done by these side cheek teeth, horses also have the incisors at the front, which is absolutely critical to those on pasture being able to cut the grass off and eat. There is a condition affecting the incisors of horses where it causes, where they can look basically normal from the outside, but underneath the gum line they become large and inflamed and even abscessed, and it's really quite painful. One of the first signs that you might see of this is a horse who's a little bit reluctant to actually bite that carrot off because it does cause them pain under the jawline. And these sometimes need some x-rays, but certainly need a sedation and a good investigation by your dental technician or vet. So remember, as we're looking at caring for our senior horses, this dentition is incredibly important. Lack of being able to take food in affects the amount of nutrition they can absorb from feed. It affects how much they absorb. It affects their chewing. It also, if a horse can't cut their hay down enough, can really increase the risk of impaction colic or even choke. So if you have one of our beautiful senior horses, as well as everything else that I'm talking to you about in this senior horse series, please make sure that you pencil in there a 2-yearly dental hygiene check, because this is the way that you are going to assure your senior horse a great quality of life. Thanks for listening. Again, please don't forget to subscribe to the channel. Click the like on this. It actually really helps me. Any interactions on YouTube, like the likes, any comments or any shares from YouTube really help. And that's really going to support what I would like to do, which is continue to provide these free videos on factual horse health and welfare. Thanks again, and I'll see you next time.